Hello, today we will be talking about OET writing criteria, like on what basis OET is examining your writing task. So here are the five things that examiners are looking for in your letter. They will be looking for overall task achievement, appropriateness of your language, and then comprehension of stimulus, that is this person were able to understand the writing task or not. Then linguistic features, then presentation features, spelling, punctuation, articles, and preposition use as well. And we can discuss this point in one-on-one lectures, and it will take 4 to 5 lectures, and each lecture will be 40 to 50 minutes long. Now we will talk about OET writing criterias. I have downloaded a PDF from the OET official website, and they have given these 6 criterias against which they will mark your letter. So, ever wonder why some OET letters score higher than others, even when grammar looks okay? It is because of these 6 official OET writing assessment criteria. In this video, I'll break them down for you with examples of what mistakes I usually make, and you can understand them better. And then you will be able to understand what examiner is looking for, so you can make your letter more better. I have my own version of these criteria, like I have summarized them here. So let's start from the conciseness and clarity. If it is about information is well summarized, written clearly, and no irrelevant information as given here. Basically, avoid irrelevant information and ensure case notes are summarized well. My tip here is that shorter sentences are your best friends. Always use short sentences. Some students use long run on sentences, and they are very risky because in them more chances of grammatical errors. So always use shorter sentences. Run on sentences are your biggest enemy. And about irrelevant information, avoid using irrelevant information from the case notes. It will also occupy your word count. Also, it will dilute the importance of your main writing task. Just an example, like if your main issue is to discuss the allergy to an antibiotic, and you want doctor to write alternative antibiotic for this patient, so you will be talking about that antibiotic in your letter. But some students do, they include past prescriptions as well, like let's see that patient have been using imodium for gastroenteritis in the past, so they will include imodium as well. So that is irrelevant, and it will dilute the importance of the bacterium. So that's how you will avoid irrelevant information. And there is a letter on official OET website as well. Let's have a look at it. This is for the Alistair Monroe. Most of the students have already done this letter. So in this letter, the writing task is mainly to outline Mr. Monroe medication regime, any potential adverse effect to be aware of, and when to seek further medical advice. Now, in this letter, your writing task is mainly to highlight medication regimen and side effects. But here they have given a lot of details about the surgery which the patient went through. So you won't be talking about the surgery, like you won't be telling that he was admitted, the presenting complaints were this, then he was given pre-operative journal investigation, and then he was given the general anesthesia, heparin, IV antibiotics, and then total post-operative care. So you won't be mentioning these things because these are not your writing task. If you will talk about these things, it will be irrelevant. It will show the examiner that this student does not understand the writing task when we talk about the comprehension of case notes. So it will dilute the importance of the main issue, which is the medication regimen. So you have to talk about medication regimen only, that is given here, like what medication he is going to take and also their side effects. So your main writing task is only this. You cannot include extra irrelevant information. So the first point is now clarified. Now the next criteria is the purpose, which is my personal favorite. Why are you writing this letter should be immediately clear, and it can be only done in your first paragraph. So your first paragraph should contain the purpose. Why are you writing this letter? Official documents say helps the reader get a quick and precise sense of what is asked of them. The purpose should be introduced earlier in the document and then clearly expanded later. How can you draft the first paragraph? That purpose is clear. So purpose is basically answering questions. Why are you writing this letter? So you will always find why are you writing this letter in the writing task. Writing task is given in every case notes here at the end, writing task. So why are you writing this letter? Your reason for writing is always given in the writing task. You will always look for the writing task here, right? But you cannot just simply say the writing task in the first paragraph. Like you have to build up a proper paragraph, and your first paragraph should contain three things. Let's have a look at from this slide what three things are. It should contain name of patient, condition of patient, which could be main condition or current medical condition of the patient. And third thing is reason for writing the letter. So these three things should be in your first paragraph. You can have a look at from this example as well. How to craft first paragraph. I'm writing regarding your resident, Mr. Alistair Monrio, who has undergone total right shoulder surgery in our hospital. On his discharge, I would like to discuss his medication regimen and any potential side effect associated with it and when to seek further medical advice. Now, you see, first of all, we mentioned the name of patient, then medical condition, which was the current medical condition of the patient that he went through surgery in our hospital. Then the writing task, medication regimen, potential side effects, and when to seek further medical advice. That's how you will make your first paragraph. The next criteria is genre and style. Writing style should be polite and factual. There should be appropriate use of terms and abbreviations. About terms and abbreviations, it's like we won't be using any abbreviations in OET, like any unnecessary abbreviation, and also we won't be doing any unnecessary capitalization. There is also a separate lecture on this part as well, like what we should include in our letter and what we should not. That is the do and don'ts of the OET writing. So basically, writing style should be factual. By factual, they mean clinical and appropriate to the document and the reader. So let's talk about style a bit. Whom you are writing to is very important. That will decide your style for writing the letter. For example, writing to a doctor or nurse, you can use medical terminologies. Like let's say you are telling a doctor or nurse that patient is taking omeprazole for GERD. You can say GERD here because they understand these medical terms. But when you're writing to a caregiver like the daughter and like let's say mother, anyone, any caregiver of the patient, you will be avoiding using medical jargons. Like let's say when you say omeprazole for GERD, they won't be understanding what GERD is. So you can say omeprazole for acid reflux. That's how you will be using your language. Like that's also known as style. Like you are styling appropriately in accordance with whom you are writing this letter to. Next criteria is organization and layout. Letter is well organized in paragraphs and formal layout. So your letter should be well structured. Let me show you the structure. How can you structure your letter by in the paragraphs? So basically, your letter should be containing the introduction part, that is like dear doctor, the address, and the salutation part. And then your first paragraph should be purpose. Second paragraph should be background if applicable, because background is not required in all the letters, but in some letters we require it. Then fourth and third paragraph will be the body, main body of your letter. And then in fifth paragraph, you will be concluding your letter with the reason for writing. So this is how you will structure your paragraph. Like there should be a logical flow of paragraphs in your letter. And you should be writing everything in chronological order from earliest to latest. Then the fifth criteria is content. Official samples say all key information is included and accurately represented. Audience awareness is key. Write what the reader needs to know to continue the care. So, all key information should be included and it should be accurate. So whatever they have asked you to write in writing task, you have to write all that thing. Let's say your writing task is to talk about the medications of the patient, and patients have five medications. So you have to talk about all of those five medications. Let's say if you miss any of this medication, let's say you mentioned four and you missed one. So that is a content mistake, that you missed one important key information. Even if you talk about medication like you missed its milligram and you missed how many times to take it, like once daily, twice daily, and even if they said PRN as required with it and you have not mentioned it, that's also will be count as a content information missing in your letter, because writing task require that information and you missed it. Anything they ask in writing task, you have to mention it in the letter. If you miss it, it will known as the content mistake. And last criteria is the language. Your language should be accurate in terms of spelling, punctuation, grammar, vocabulary, article, preposition, and even coherence. And by coherent, I mean you have to use signposting very well. And we have separate lecture for signposting, grammar, vocabulary, spelling, even use of article and preposition as well.